The first two factors that affect the nursing process include lack of effective communication skills and the nurse-patient relationship. Communication is a necessity in nursing practice. Without the ability to effectively communicate, it becomes very difficult to form a good rapport with patients. In turn, this greatly affects the entire nursing process. For example, nurses may be less involved with a patient's care, or the patient may be less likely to engage. If the trust between the two is not built, quality of care is diminished. There is also often stigma towards those with mental illness. This can significantly compromise person-centered care, as well as the relationship between the nurse and the patient. The nursing process is often dependent on policies, as nurses aim to act within the standards of their facility. Another factor is the patient load on nurses. Being short-staffed can be a barrier to performing concise assessments, being empathetic, and can also often hinder patient-nurse relationships. The nursing process can be affected by others' opinions. Nurses may be hesitant to continue with a task without confirmation from another. They may look to other healthcare staff for support or agreement on certain situations. A history of violent behavior or non-compliance can also affect a nurse's willingness to engage in proper care. And lastly, safety and security is a factor. Do nurses have a safety protocol in place? Does the nurse feel safe to perform their duty? Is security accessible if needed? When safety is in jeopardy, nurses may avoid patients when possible, effective relationships are not built, and patients often do not receive the full care that they need.
Created using Powtoon.